Do you have noticeable varicose veins? Do they bother you because of how they look or maybe how they feel? What can be done about them? We welcome Dr. John Rossi of Calcagno and Rossi Vein Treatment Center back to Good Day PA. Good to see you again, sir.
Hi, Amy. How are you?
Very good, thank
good,
you.
good.
So, you know, I, for the longest time, did think of varicose veins as just something cosmetic, something that kind of looked a little bit unsightly, but you say it goes beyond that.
Yeah, really, they're a medical condition, and it causes a condition called venous hypertension in your legs, and that high pressure in your legs causes symptoms in patients of fatigue, heaviness, swelling, can lead to skin damage, even later on can cause ulceration. When blood's not moving properly, it can clot. So there can be complications from varicose vein disease. So it's a medical condition. It's not really just purely a cosmetic issue.
Okay, good to know. And then varicose veins and spider veins are not the same, right?
Yeah, well, they're similar. Spider veins are really tiny varicose veins that are in the skin. Varicose veins occur below the skin in the subcutaneous fat. They get bigger. They're just like dilated water balloons from that venous pressure that occurs. And those are the veins that usually cause significant symptoms. Although even patients with spider veins, about 85% of the time will have symptoms: burning, itching, aching on the thighs, and so forth. So even when those are treated, frequently those symptoms will go away.
And again, it's not just the appearance of the vein, but it's actually vein disease?
Yeah, it's vein disease. The valves in the veins, this is a genetic issue. About 30 million people have it. 40% of the women over 50 have the disease.
Oh, wow, 40%.
40%, so it's very, very common. And the valves degenerate, and what happens when the valves degenerate is that instead of the blood flowing out of the leg and getting back to your heart, fluid rolls downhill with gravity, and your leg will fill up like a bucket of water. So you have this heavy cylinder that you're dragging around all day. People get used to that because the symptoms come on very slowly over time. Frequently after we fix it, when they take a few steps off the table and their normal veins empty their legs, they notice it almost immediately that their legs feel better.
Oh, that must be incredible feeling too after dealing with that for so long. So there are ways to treat this. Radiofrequency, that's a procedure, and then there's vein stripping. What are the differences here?
Yeah, vein stripping, we really don't do that anymore. That's an older operation. Was associated with a lot of discomfort, required surgery, hospitalization. Now we use radiofrequency catheters to treat the veins, and what that really requires is under local anesthetic a small catheter being put in the vein, and then we use radiofrequency energy after we numb up the leg to basically close the vein from the inside, and that turns the vein into a tuba scar. That's the same as having the vein subsequently removed, and so what occurs is that your body just absorbs it. The leak where the blood was flowing backwards is now gone, and your normal veins take over and they empty your leg.
Okay, so if somebody's watching right now and they think, okay, I didn't know all of this, maybe I should have this looked at. You actually have an event coming up.
Yeah, we have vein screenings periodically through the year, and we actually have one next week. It's on the 21st and 22nd, Tuesday and Wednesday from 12 to 7, and it gives the patients an opportunity to have an ultrasound to see if indeed the venous flow is going backwards in their legs, to discuss that with the physician, to educate themselves about whether or not they have the problem, and then to make an informed decision about whether they want to do anything about it.
That's a very good opportunity. Where are you located?
We're at 2025 Technology Parkway in Mechanicsburg at Suite 304.
Very good. Good information. So I always learn so much. Thank you,
You're
Dr.
welcome.
Rossi.
You're welcome, Amy.